Good evening, everyone. In this session, we'll be discussing about coccydynia tailbone pain, and most importantly, we'll discuss why the tailbone pain is commonly misdiagnosed or underdiagnosed. I will be seeing a number of patients daily for whom the diagnosis of tailbone has been missed since years. They'll be suffering with low back pain because the diagnosis has been missed by many people. So let me present my topic. Why is coccydynia or the tailbone pain commonly missed? So my present topic is dynamic instability of coccyx, and it is a missed cause of coccydynia. So you will have to understand what is dynamic instability of coccyx. When you understand this, you will understand why the tailbone pain or coccydynia is frequently missed or underdiagnosed. So you'll have to understand the concept of unstable tailbone joints. Tailbone is a coccyx. Unstable tailbone joints are dynamic coccygeal instability is one of the most common causes of tailbone pain and is largely not diagnosed. And this dynamic coccygeal instability is 20 times more common than a coccygeal fracture. What is instability? Instability is excessive mobility at a joint. Dynamic instability means an instability which keeps changing with the posture of the patient. In coccyx, dynamic instability is abnormal movement of coccyx which is absent in standing and it is present during sitting. Correspondingly, patient will have pain while sitting and will be pain-free while standing. When a patient puts its weight on coccyx while sitting, the dynamic instability sets in. The coccyx moves excessively, putting pressure on the coccyx and its ligaments, causing excessive pain. So let me summarize this slide. So dynamic instability is dynamic. It is not present always. It comes into picture only while sitting, and so the patient will also be having pain while sitting. Observe this picture. This is the sacrum. S1, S2, S3, S4, S5. These are the 5 segments of sacrum. This last point, which is labeled as C1, C1, C2, 3, 4. These small segments of bone, which are down in between your both buttocks, is the coccyx or the tailbone. You can observe the normal coccyx as a gentle curve forwards. And what is normal mobility of coccyx? Normally, observe this movement. The coccyx has a slight movement normals. Normally, coccyx has some mobility and moves slightly forward when you sit. So what you have observed just now, the coccyx was slightly moving forward. This is normal. Why is this present? Why has God given this slight movement to our coccyx? This small forward movement tucks the coccyx deep in between our buttocks and makes sitting painless. And because the movements are small and they are within the physiological range, the coccygeal ligaments are adapted to this small movement and they are not strained with the small movements. How much is normal? Physiologically, the forward movement is less than 20 degrees. Did you observe? In this video, this coccyx has moved abnormally forwards. So the normal physiological flexion has become exaggerated. And this excessive forward flexion of coccyx puts excessive pressure on ligaments, leading to pain. So this excessive flexion of coccyx, which happens during sitting in some patients, causes excessive pressure on the ligaments, leading to pain. Observe this. This is reverse. In some people, instead of moving forwards, the coccyx moves backwards while sitting. In these people, the coccyx literally sticks out and directly hits the hard surface of chair while sitting because it directly protrudes out and is not protected by the cushioning effects of the buttocks. This repeated trauma causes pain. Observe this. Here, in addition to forward movement, there is gliding or slipping of coccyx below the sacrum. This sliding is also known as subluxation. So this sliding causes abnormal strain on the ligaments, and in addition it causes abnormal strain on the sacrococcygeal joint also. This causes pain while sitting. Now, let us answer our question. This dynamic instability is usually missed by physicians. Why? There are few reasons. One, the X-rays are by default ordered in the standing position. As I've explained you before, the dynamic instability is seen only when the patient sits. In standing, the coccyx is normal. So in standing X-rays, the coccyx appears absolutely normal. Suppose the physician is aware of it and he orders for dynamic X-rays in the sitting position, but technical staff are usually not trained. So they fail to take adequate pictures of the coccyx. And in many cases, the routine X-rays which are taken for back pain, they completely exclude the coccyx. Because of the above reasons, the cause of coccydynia is usually missed, and the patient suffers for a long time as the diagnosis is missed and will not receive the correct treatment for a long time. So how do you diagnose this? You see this picture. This picture has been taken when the patient is standing. This X-ray has been taken when the patient is sitting. So in this standing position, the coccygeal X-rays are absolutely normal. But when the patient sits, the coccyx goes into subluxation. You can see the subluxation. The coccyx is gliding on the sacrum. And so the diagnosis is evident. So when the X-ray is taken in the sitting position with the correct protocol, the coccyx subluxates and the diagnosis is glaring in the X-ray as seen on the right side. So in this patient, if I am not aware of coccydynia, if I don't ask for dynamic X-rays, that is sit-stand X-rays, this patient I will not make the diagnosis and the patient is going to suffer forever. And so how to get a dynamic X-rays of coccyx? Obtaining sit-stand X-rays is a big challenge both for the patients and their doctors. Very few radiology centers have ever even heard of a tailbone X-rays being taken while you are sitting. Sometimes a radiology center will give it a try, but they lack experience from never having done this test before. This can result in the test being done inaccurately and thus failing to give you reliable results. Even if the radiology technician performs a test properly, the radiologist or the physician has likely never heard of standing or sitting X-rays, and therefore both the radiologist and the physician may be unable to confidently read or interpret your X-rays. So you need to reach out to a medical center which experience in getting this dynamic X-rays done, or else routine standing X-rays will be normal. So let me complete my presentation. Let me conclude. If you think you are suffering from tailbone pain or coccydynia, you will have to reach out to medical centers who have experience in diagnosing it and treating it. Thank you very much. I'm Dr. Kalyan. I'm a neurosurgeon and spine surgeon working in Hyderabad, and I'm at Aware Gleneagles Global Hospital, LB Nagar, Hyderabad. If you feel any of your friends are suffering from tailbone pain, do share this video with them. Thank you.